Hey guys, it's Dr. Ryan here. Um, Today I was doing an interview with a new patient or a prospective new patient, somebody who wanted to come into our office, and she shared with me that she's on 21 different medications. This person's symptomatology ranged everywhere from pain to anxiety disorder, some digestive tract disorders, blood pressure challenges, trouble concentrating, trouble sleeping, really unhealthy skin, so really itchy all the time, flaring up in rashes. She was just really suffering, and I really it really bothers me when I see somebody like this because she's so far from healthy. And I asked her, how did you get on this road to where you are now? Where you are now is nowhere near, the kind of healthy person that you were designed to be. And, she told me and she shared with me that she was actually at one point on 36 different medications. And through lifestyle changes and whatnot, she's brought it down to 21. And I thought about that, and I wonder how many people on that many medications would even be able to heal. Even if you did everything right, would they be able to heal? I mean, if you think about it, they say the average person in a nursing home takes 17 pills a day. When's the last time, and this is a good question, when's the last time you saw somebody go into a nursing home, take all those drugs, get better, and come back out? Like, when's the last time you saw that happen? And so it's interesting that this research study came up on my desk today. It's not new, but it came up on my desk again, and it's from Statistics Canada. So from Health Canada, it's called Medication Use Among Senior Canadians. Um, Pamela L. Ramage Morin, and it's in the Health Canada stats reports and health reports. So you could go to statscan.gc.ca, Google medication use among senior Canadians, and you could read this entire report yourself. Um, and I want to get it right, so I'm going to read just the one part just to confirm. First. This is the first nationwide population-based study to provide multiple benchmarks of medication and multiple medication use amongst all Canadian seniors, covering not just the private households but also those in long-term healthcare institutions. So basically, they looked at all seniors who live in Canada, regardless of if they lived at home or lived in a long-term healthcare facility, whether they were in a hospice, whether they were in hospital, regardless, included all seniors. So here's what they found. So they started off with saying that multiple medication use and prescription or over the counter is a common concern in relation to seniors' health. We know that. But this goes on to talk about just the prescriptions that are given out. So pharmacists dispense an average of 35 prescriptions per person per year for those between the ages of 60 and 79. They dispense an average of 35 prescriptions per year. So that's a new pill, new bottle of pills every 10 days as an average for people who are between the age of 60 and 79. And for those who are age 80 and older, they're averaging filling 74 prescriptions per person per year. That's a new entire bottle of pills every 3.5 days. Now, I know that people sometimes go to the pharmacy and fill 5, 6, 7 prescriptions at once, but if they had to do it one at a time, they would be at the drugstore twice a week to get a new bottle of pills. Think about that. Think about the type of habits that we're creating in our culture here. This led to and that doesn't include, so this includes uh, um, um, prescriptions that are filled. So that doesn't include, how sometimes a family doctor or hospital will write a prescription, but the person chooses not to fill the prescription. So this doesn't include all of those prescriptions. Plus, this doesn't include any over the counter pills. So no over-the-counter pain medications or anti-inflammatories, no Tylenols or Advils or Robaxacets, no allergy medications, no medication of any sort that isn't that is sold over the counter is included in those numbers, right? So if people are taking those, plus they're taking aspirin and they're taking Tylenols and they're popping a couple Advils, these don't include those numbers. This is how mind-boggling the number of drugs we're taking is today. So it turns out into a overall average of 14 prescriptions per Canadian per year. So include all babies in that number. The average Canadian is filling more than once a month, filling a prescription 14 times a year. So if a family is filling no prescriptions in a year, right? So in my family we have 4 kids and my wife, so we have 6 of us. If we fill no prescriptions all year, another family is filling 28 prescriptions per person per year to get to that average of 14. This is a serious problem. And then they go on to say multiple times in it, elevated risk of drug-related adverse events from multiple medication use. And one of the biggest challenges is that people are seeing all these different specialists who know more and more about less and less, so they have a less of an idea of how things affect the overall body, and they don't really take into account what other doctors have prescribed for this person. So they go on to talk about the types of medications, and the 3 main types of medications, or the 3 highest ones, were so the first one, this is crazy, 78%, so 4 out of every 5, 78% of seniors take a medication for nerves. For nerves. I mean, these are your nerves. People think of nerves as, just, you feel pain through your nerves. Yes, that's one thing that nerves do. But the nerves control and regulate all function in your body. They control and regulate all healing, right? If the nerves are damaged, your body cannot heal, right? I mean, think about it. If you cut the nerve to a tooth, what happens to a tooth? It dies, right? Parts of your body die when they're disconnected from the nerves, when the nerves don't work properly. And the third thing the nerves do is they control and coordinate the regulation of the creation of new cells in all the new parts of the body. So your body's ability to not age as quickly has everything to do with the nerves. So when you take drugs that affect the nerves, drugs like analgesics, that would be painkillers, right? The other nerve-based drugs were psycholeptics, antipsychotics, anti-anxiety pills, hypnotics, and sedatives. I can't make this stuff up. The second thing was medications for the alimentary tract, which is think of the pathway that food would take going through your body, right? So going down the esophagus into the stomach. So people might have like an acid reflux or heartburn. People might have like a digestive issues, irritable bowel type symptoms, bloating, things like that. That 71% of seniors were on drugs for that. And 55% were on cardiovascular drugs. So those would be things like blood pressure pills and cholesterol pills, etc. It says more than half of all seniors, 55% were taking those cardiovascular medications. So again, it says medication use was generally associated with morbidity. Hang on. Morbidity is death. So what they showed time and again, and they showed it in the different charts here, right? You can read through the different charts on here, but it's showing the more medication that you take, the more likely you are to die. Now, I think the sicker you are, the closer you are to death, the more likely you are to be on medication trying to salvage what you have left of life. So I get that. But the idea is that the more you're taking, and it says regardless of the reason, those who take multiple medications always have an elevated risk of adverse events. And the primary adverse event being death. Okay, as morbidity is the main one that they measure in here. And I think this sort of begs the question is, do we really understand that the drug problem that we have? And when people say, I know I'm on lots of medication, or people say, I think we take lots of medication, this shows you, I mean, Canada as a leader, we take some of the highest concentrations of drugs compared to anywhere else in the world. I think that's worth noting, and I think that's worth sharing. I just want to keep bringing you information that you would find helpful and useful, and things that I think that I think you should be made aware of. All right, guys. Until next time, have a great one. Thanks.